Hey there, I'm Dr. Eliza, and today I want to talk with you about something incredibly simple yet surprisingly powerful when it comes to sexual health, overall vitality, and how your body functions every single day. And that is water, plain, ordinary H2O, something most people overlook or take for granted without realizing how deeply it influences nearly every system in the body. You might be wondering how something as basic as water could possibly affect erection quality, energy, or libido. But it's important to understand that the human body is made up of more than 60% water, and every organ, tissue, and cell, including the brain, heart, blood vessels, and reproductive organs, relies on proper hydration to function optimally. So when you are not drinking enough, your body senses it immediately and begins to adjust in ways that are not always beneficial. And yes, this includes how well blood flows to the penis and how responsive your sexual system feels overall. Because hydration directly influences blood circulation, hormone balance, nerve signaling, stamina, and even mood, all of which play an essential role in sexual performance and confidence. In this discussion, I'll explain in a clear and easy-to-follow way how water supports healthy blood flow, helps maintain balanced testosterone levels, boosts energy and libido, and supports the systems that allow erections to occur naturally. And I'll also share simple, science-informed hydration habits that can make a real difference in how your body absorbs and uses water, because there truly is a smarter way to hydrate that supports not only erection health, but your overall well-being. So whether your goal is optimization, prevention, or simply feeling better and more confident in your body, you are exactly where you need to be. And we can begin by understanding the foundation of erections, which is blood flow. Because an erection is essentially a hydraulic process where blood rushes into the spongy tissues of the penis and stays there long enough to create firmness. And without healthy circulation, strong erections become difficult to achieve or maintain. And this is where hydration becomes critical, since blood itself is largely composed of water. Meaning that when you are well hydrated, your blood remains less viscous, flows more smoothly through arteries and veins, and places less strain on the heart, allowing oxygen and nutrients to be delivered more efficiently throughout the body, including to the pelvic region during sexual arousal, whereas dehydration causes the blood to thicken and move more slowly, increasing resistance in the vessels, reducing pressure, and making it harder for blood to reach smaller arteries, which can directly affect erection quality. And many men are surprised to learn that frequent fatigue, reduced stamina, mental fog, or softer erections may not always be caused by aging or stress alone, but can sometimes be traced back to something as fundamental as inadequate water intake. Which is why before turning to complicated treatments or costly solutions, it's worth asking whether you are consistently drinking enough water to support proper circulation. Because for many people, improving hydration can be a meaningful and noticeable change. However, hydration doesn't stop at circulation, because water also plays a crucial role in hormonal balance, particularly testosterone, which is the primary hormone responsible for male libido, muscle strength, motivation, mood stability, and sexual performance. And when the body becomes dehydrated, it shifts into a conservation or survival mode, prioritizing immediate needs such as temperature regulation and blood pressure, while reducing support for systems that are not essential for short-term survival, including reproductive function. And research shows that dehydration can increase cortisol, the body's main stress hormone. And when cortisol levels rise, testosterone levels tend to fall, creating a hormonal imbalance that can reduce sexual desire, lower energy, impair focus, and negatively affect mood. And over time, chronic dehydration can place extra strain on the liver and kidneys, organs that are responsible for filtering waste and regulating hormones, meaning that when they are not functioning efficiently, hormone regulation can also suffer. So if you ever notice periods of low motivation, persistent tiredness, irritability, or a reduced interest in intimacy, it's worth considering hydration as a contributing factor rather than assuming it's solely due to stress or age. Knowing why water matters is only part of the picture, though, because how you drink water can influence how effectively your body absorbs and uses it. And small habits can significantly affect digestion, circulation, and hormonal balance, starting with the pace at which you drink, since sipping water gradually throughout the day allows your body to absorb fluids efficiently, whereas drinking large amounts all at once can overwhelm absorption and lead to excess being excreted without fully benefiting your cells. And posture matters too, because drinking water while seated encourages relaxation of the nervous system, supports digestion, and allows circulation to regulate more smoothly, including blood flow to the pelvic region. And another often overlooked practice is allowing water to mix with saliva by taking small sips and briefly holding them in the mouth before swallowing, since saliva contains enzymes and has an alkaline quality that helps prepare the digestive tract for absorption. A concept rooted in traditional wellness practices and increasingly recognized by modern nutrition science. And temperature also plays a role, because while cold water can feel refreshing, it can temporarily slow digestion and require the body to expend energy warming it internally. Whereas room temperature or warm water is gentler on the system and supports smoother digestion and nutrient absorption. And while these habits may seem minor, over time they contribute to improved circulation, hormonal stability, and nervous system balance, all of which support a healthy and responsive sexual system. People often ask how much water they should drink, and while individual needs vary based on body size, activity level, diet, and climate, a general guideline for many adults is roughly 2.5 to 3 liters per day, or about 10 to 12 glasses, spread evenly throughout the day. But timing is just as important as quantity, because drinking large amounts of water right before bed can disrupt sleep due to nighttime urination, and poor sleep is strongly linked to reduced testosterone production, while drinking excessive water immediately after meals can dilute stomach acid and slow digestion. So waiting about 30 minutes after eating before drinking again can support better digestive efficiency. And when consuming water, rich fruits such as watermelon, oranges, or berries, it's helpful to avoid additional water for a short period afterward to prevent digestive discomfort. And one of the simplest ways to assess hydration is by observing urine color, which should generally be pale yellow, as dark urine suggests dehydration, while constantly clear urine may indicate overhydration, reminding us that balance is key. The central message here is that water is not just something you consume to survive, but something you use to thrive, because hydration influences blood flow, hormone regulation, energy levels, mental clarity, mood, and libido. And the beauty of it is that improving hydration does not require prescriptions, supplements, or complicated routines, only awareness, consistency, and mindful habits, since sexual health reflects overall health, and small daily choices like drinking water properly can lead to meaningful improvements in how you feel, how your body responds, and how confident you are in yourself. And to expand on this further and provide deeper educational value, it's important to understand that hydration also affects the nervous system, which plays a direct role in sexual response, because arousal begins in the brain and relies on efficient nerve signaling to communicate with blood vessels and muscles. And dehydration can impair nerve conduction by altering electrolyte balance, leading to slower response times and reduced sensitivity, which may affect arousal and sensation. And adequate water intake helps maintain proper levels of electrolytes, such as sodium, potassium, and magnesium, which are essential for nerve impulses and muscle function, including the smooth muscle relaxation required for blood vessels in the penis to expand during an erection and beyond sexual health. Hydration supports cardiovascular health by helping regulate blood pressure and heart rate, reducing strain on the heart, and supporting arterial flexibility, which is particularly important because erectile function is often considered an early indicator of vascular health, meaning that difficulties with erections can sometimes signal underlying circulation issues. So maintaining hydration can be part of a proactive approach to long-term heart and vascular wellness. And hydration also influences metabolism and energy production at the cellular level, since water is necessary for the biochemical reactions that produce ATP, the molecule that supplies energy to cells. And when energy production is compromised, fatigue increases, motivation decreases, and physical performance, including sexual endurance, may decline. And another important aspect is how hydration affects digestion and nutrient absorption, because water helps break down food, transport nutrients, and prevent constipation, and nutrients such as zinc, magnesium, and B vitamins are essential for testosterone production, nerve health, and energy levels. So without adequate hydration, even a nutrient-rich diet may not deliver its full benefits, and hydration also supports detoxification by aiding the kidneys and liver in removing waste products and excess hormones, helping maintain hormonal balance and reducing systemic inflammation, which is increasingly recognized as a factor in erectile dysfunction and reduced libido. And speaking of inflammation, chronic low-level dehydration can contribute to inflammatory processes in the body, affecting blood vessels and tissues over time, whereas consistent hydration helps maintain tissue elasticity and joint lubrication, supporting physical comfort and mobility, which indirectly supports confidence and overall quality of life. And from a psychological perspective, even mild dehydration has been shown to affect mood, concentration, and stress perception, increasing irritability and reducing mental resilience. And since psychological factors such as stress, anxiety, and self-confidence play a significant role in sexual performance, maintaining hydration can support a calmer, more focused mental state that is conducive to intimacy. And it's also worth noting that many common beverages, such as coffee, alcohol, and sugary drinks, can contribute to dehydration or disrupt fluid balance, especially when consumed in excess. And while moderate coffee intake can be part of a healthy lifestyle, excessive caffeine can increase urination and stimulate the nervous system in ways that may interfere with relaxation and arousal. And alcohol, while sometimes perceived as a relaxant, can impair nerve signaling, reduce testosterone production, and disrupt sleep, all of which can negatively affect sexual performance, making water an essential counterbalance when such beverages are consumed. And incorporating hydration into daily routines can be made easier by starting the day with a glass of water upon waking to rehydrate after sleep, carrying a reusable water bottle as a visual reminder, pairing water intake with regular activities such as meals or breaks, and choosing water-rich foods like vegetables, soups, and fruits to support overall fluid intake. And for individuals who exercise regularly, hydration becomes even more important, as physical activity increases fluid loss through sweat, and dehydration during or after exercise can impair recovery, increase muscle soreness, and elevate stress hormones, whereas proper hydration supports circulation, muscle repair, and hormonal balance, all of which contribute to physical vitality and sexual health. And as we age, the sensation of thirst can become less reliable, making conscious hydration even more important for older adults, because aging blood vessels may already be less flexible, and hydration helps maintain elasticity and blood flow, supporting not only sexual health, but cognitive function and joint comfort. And it's also important to recognize that certain medications, medical conditions, and diets can affect hydration needs, such as diuretics, high-protein diets, or environments with high heat or altitude, making personalized awareness essential. And while water is fundamental, balance matters, because excessive water intake without adequate electrolytes can lead to imbalances, emphasizing the importance of listening to your body and maintaining moderation. And from an educational standpoint, understanding hydration empowers individuals to take control of their health using one of the most accessible tools available, reinforcing that complex problems do not always require complex solutions. And by viewing hydration as a foundational practice, rather than an afterthought, people can support multiple systems simultaneously, including cardiovascular, hormonal, neurological, and digestive health, all of which converge in sexual function. And ultimately, embracing proper hydration is about supporting the body's natural ability to regulate itself, heal, and perform, fostering resilience, confidence, and long-term well-being. And when hydration becomes a consistent habit rather than a sporadic effort, its cumulative benefits extend far beyond sexual health, influencing longevity, mental clarity, emotional balance, and physical comfort, reminding us that the simplest habits often have the most profound impact when practiced with intention and consistency, and by staying informed, mindful, and proactive about hydration, you're investing in your body's capacity to function at its best today and for years to come.